One other thing about integrated care is it all hangs off primary and community services. Why is that? It's because primary care, a US term, is the medical home for patients. Patients make occasional use of an emergency department, occasional use of a hospital. Where they get the bulk of their health services is in primary care. And primary care deals with the whole rather than parts. Specialists deal with the parts. Primary care, in theory at least, deals with the whole patient, the whole family, and can look at the neighbourhood context around a patient and a family. And that is just fundamental to integrated care, and it's fundamental to acute demand management, and it's fundamental to management of chronic disease. Now, one of the difficulties in that is that primary care is not in a strong start point for taking on this role. I think it's even less so in Australia than it is in New Zealand. But if you're going to have an impact on acute demand, primary care needs to step up and start doing more, playing a bigger role inside a health system than it has historically. Health systems that are dealing with this kind of issue have got two major structural platforms that they hang primary care development off. The first of these is the notion of multidisciplinary teams in the community that are formed around general practice. So this is essentially nursing and allied health, which in most health systems are attached for historic reasons to a hospital. So allied health primarily works inside a hospital setting. That needs to change. And secondly, community nursing hangs off a hospital structure for historic reasons. That needs to change. So it requires a fundamental rethink of where in the system, organisationally, community nursing and allied health sit, and also how do you get them into some sort of configuration that allows them to work across multiple general practices, because they work at a population level, whereas general practice works at a patient level, with patients coming from all over the place. So how do you marry those two things and also start to build the notion of multidisciplinary teams? So health systems, certainly in New Zealand and in a number of other countries that I heard about at the conference in Brussels, are developing this notion of neighbourhood hubs. In other words, there is a community nursing and allied health team that operates at a neighbourhood level and works really closely with the general practices in that neighbourhood. And the second thing that health systems are doing are developing umbrella organisations across general practice, and as a way of helping bind those to community nursing and allied health. So here, until recently, well, in fact, you still do, you have Medicare locals that are clearly on their way out to be replaced by something that people aren't sure how it's going to be different from Medicare locals, but one might think it could be a little bit closer to the primary health organisation role in New Zealand. So these two concepts of multidisciplinary teams and a key role for meso-level primary care organisations are fundamental. And what's a multidisciplinary team? Here's one. We like to think this is not what's in mind. You'll notice he's smoking too, which is very bad.